Why public health research matters. Objectives. You will learn about vulnerable populations, institutional review board, dichotomous variables, and how to compare them. So vulnerable populations. This is a list and it is ever increasing, but it includes, but not limited to, pregnant women, minors. Remember, minors they've not reached the age of consent yet. Incarcerated individuals, disabled, chronically ill, low-income individuals, LGBTQ, marginalized, undocumented immigrants, think that they might not understand what's going on or think that this will get them healthcare or citizenship. And so vulnerable populations frequently have unmet physical, psychological, or social needs. They often need more protections because of a higher risk for negative outcomes, or rather they have a higher disparity of poor outcomes. So who is going to protect vulnerable populations and or any research population? It is the Institutional Review Board. The purpose of the IRB is to assure both in advance and by periodic review that appropriate steps are taken to protect the rights and welfare of humans participating as subjects in research. They were developed after World War II due to the atrocious studies that were done on prisoners at concentration camps. And if you have any interest in history, you can look up the Nuremberg Code and the Declaration of Helsinki, which is an ongoing document. So we're going to look at a cross-sectional public health study. And if you want to actually pull up the study, you can use this QR code. So this is sexual health experiences among high school students with disabilities. They queried 11th graders across Oregon regarding disability and sex. They asked them if they felt they had any of these disabilities, and these were their questions on sex and demographics. It's a little bit strange that Everforced is a demographic, but it allowed them to stratify these different questions here. Now, a survey is typically thought to be minimum risk. So did the researchers have to get approval from an IRB? The answer is absolutely. You cannot bypass an IRB, especially when you are dealing with a vulnerable population, and 11th graders or adolescents, minors, are definitely vulnerable, as well as you're getting into LGBTQ information. So what do you think they found? In a way, this is sort of my little scavenger hunt here. Who is more likely to be disabled, females or males? Do disabled adolescents have less sex than their non-disabled peers or more? Which disabilities are associated with an adolescent having sex? And are adolescents with disabilities more likely to have been forced to have sex? So we're going to find the answers to all of these. So remember, the typical assumption is that a p-value of less than 0.05 shows statistical difference. So when I look at a paper, I often read the abstract and then I look at the tables. Table 1 typically will give you the characteristics of the study population, and Table 2 will typically give you the outcomes or the results. So this is their Table 1, the characteristics, and we can see that in students with a disability, they were much more likely to be female, and they were also likely or more likely to be non-binary. As well, they were more likely to be LGBTQ. And this is something that we're learning through public health, is that persons with disabilities, and especially the autistic community, tend to have more LGBTQ. So to answer our first question, females in this study population were more likely to be disabled. So now we're going into the results. Do disabled adolescents have more sex or less? Which disabilities are associated with an adolescent having sex? And were they more likely to have been forced? So this is a paragraph that I pasted in from the results, that students with disabilities were more likely to have had sexual intercourse than those without disabilities. And it was significant, and these are the percentiles. The disabilities more associated with having sex were cognitive disabilities, having more than one disability, and any issues with independent self-living. And then this, I pulled a segment of Table 2, and everything in bold is considered statistically significant. And you can see that any disability, they were more likely to have been forced to have sex, pressured to have sex, have had sex with an adult, engaged in sexual activity before the age of 15, having more than 2 lifetime partners, having more than 2 partners in the last 3 months, having used alcohol or drugs, and not using condoms. So I think this is very telling. So they found that disabled adolescents were more likely to have sex. Those that had cognitive problems, multiple disabilities, or disabilities related to independence were more likely to be having sex. And adolescents with disabilities were more likely to have been forced to have sex. So you might be thinking to yourself that that is a little bit sad, that it does seem that adolescents with disabilities are being taken advantage of, and that's true. And we probably wouldn't know that if this study hadn't been done. And so it's important to study vulnerable populations, to stick up for those who might not have a voice, to right wrongs, to help protect them, and to level out disparities. So be proud to study public health. So now we're going to go on to dichotomous variables. It's the last thing that we're going to talk about. These are binary variables. They are a form of categorical data, and it's something that you are asking a question that can be answered typically with a yes or no. So in this case, were you ever forced to have sex? That's a yes or no question. And in the two groups, 7.1% of the non-disabled students said they were forced to have sex, while 20% of the disabled students were forced to have sex. So if you do the math, which I've done here, in our non-disabled group, these would have answered yes, and these participants would have answered no. And then likewise in the disabled group, the yes and no. But how do we compare these groups? The answer is with a chi-square test, which is also known as a 2x2 contingency table. So when you put in your contingency table, this is how you would enter your data, and we're going to do this all together. So if you'd like to play along, you can open this QR code, which opens the Vassar Stats 2x2 contingency table calculator. So this is the Vassar Stats 2x2 contingency table calculator. They also have a 2x3 if you have categorical data, or you can Google search 2x5 contingency table calculator. So in group 1, we're going to talk about the non-disabled group. There were 5,084 persons who were not forced to have sex, and there were 389 who were, and then in the disabled group, there were 2,253 forced to have sex, while who were not forced to have sex, and 585 who were. So then we hit calculate, and it does the chi-square test for us, or 2x2 contingency table calculations. It will give you odds ratios, risk ratios. I'm not talking about that in this lecture, but we just want to know if there's a statistically significant difference between the two groups. And this is our p-value. People use the Yates. It has a continuity correction. And the p-value is very significant. So as a take-home point here, you use the chi-square or 2x2 contingency when you have two groups answering a question with a yes-no outcome. The artwork is from autistic artists, which can be found at autismresearchtexas.org. A few last disclaimers, which you can read. And thank you very much.